audiologist here at St Vincent's, been here for quite some time, and I'm going to talk to you about what is a cochlear implant and who can benefit. So a cochlear implant is a device which bypasses the damaged part of the ear to stimulate the hair cells of the cochlea and allow people to hear. An electrode array that provides artificial hearing is placed in the cochlea. This is used with a speech processor that is worn externally. So you've seen quite a few pictures of the cochlea with Sean in the previous talk. So this is a cochlea, and you can see the electrode array, those little dots that are placed in the cochlea. This is an illustration of a cochlear implant system, of the whole system. And you can see that there's a number of parts to the cochlear implant. It's not just one simple device. Firstly, there's a behind-the-ear device which sits over the ear, and this is where the sound is captured. So a cochlear implant today looks fairly similar to a hearing aid, only it's a slightly bigger version of a hearing aid. And it sits behind the ear just like a hearing aid sits behind the ear. It also has microphones, just like a hearing aid has microphones. But instead of amplifying sound, it codes sound. And the sound is then taken up from the speech processor up into the coil, which sits up that number 3 brown circular device on the head. And the sound is transferred from there into the electrode, which it is coupled with magnetically and sits on the skin. And then the sound is changed into electrical impulses, goes down the electron array, into the cochlea, and then the sound is those impulses are then transmitted up the acoustic nerve to the brain, auditory nerve to the brain. This is a close-up picture of the actual electrode that is inserted in the skull. So the round part up the top is the part that has the magnet in it, which holds the external coil on. And what happens is there's a hollow made in the skull, and that's placed in it, and then the electrodes are placed into the cochlea. There's also a ground wire there as well, if you're wondering what that is. This is a picture of the most recent cochlear implant, which you can see, the most recent speech processor, which you can see does look something like a hearing aid, except that it has the coil attached. And this is somebody wearing a speech processor. This is the whole system that is now, this is the current system. There's been many changes, which I'll show you some of them. This is the most recent device, and you can see the implant, the speech processor, and also there's now a remote control, which has been a major help with our patients, because it's a lot easier to change programs and change volume, etc., with a remote control than it is to be fiddling up at your ear. So, St Vincent's Hospital has been involved with cochlear implants since the 1980s. So it's now over 30 years. At this time, in the beginning, only someone with a total loss of hearing could be implanted. So at that time I had patients, people that, for instance, would have difficulty hearing a plane taking off beside them. So we're talking about people who were completely deaf. And these people at that time, in the very beginning, were implanted with, at that time, in the beginning, we only had a single-channel cochlear implant. And St Vincent's was the first hospital in Australia to use the single-channel implant, which was developed in America and was sold worldwide through 3M. It was subsequently taken over by Cochlear, but at the start there were the single channel implants. Now the single channel implants were for the profoundly deaf only because the hearing that they provided was fairly limited. Implantees were able to hear with it, but it was very gross hearing, and to tell the difference between sounds was very difficult. They might confuse somebody flushing the toilet with a vacuum cleaner, or someone frying food with another sound. So they might think, I don't know, the microwave beep was someone frying food. So there was a lot of confusion with what they were hearing, but they could hear sound and they could hear speech. But again, they couldn't tell what speech they were hearing very well. And basically, the single channel implant used to work as an aid to lip reading. It helped people lip read because it told them if a word was long or short or what was happening. Give you some demonstrations for those of you who can hear it of what a single channel implant used to sound like, just to get an idea of how far we've come.
The boy did a handstand.
So that's how we would hear it normally. Okay, so that was the first implants. Today we have implants that have 24 channels. These channels provide a lot more information about speech than the older style implants were able to. And as a result, speech understanding has improved to a point where the average implant user is scoring around about the 80% or even better correct. And this has been achieved by the increase in the number of channels and the advances in technology, which have allowed implantees to hear and understand speech. So let's have a listen to what they sound like now. This is all that's available, so this is not 24 channels, but it's just giving you an idea.
A tree fell on the house.
So this is 6 channels.
A tree fell on the house.
8 channels.
Her husband brought some flowers. Her husband brought some flowers.
So you can tell that it's getting better over time. I mean, these are just simulations, but it just gives you a bit of an idea of how it's going. These are just to illustrate how the implants have changed and how they look. Initially, this one over there on the top left was the first one, the first cochlear speech processor. You can see it's got a headband to hold it in place because at that stage there were no magnets to couple the external coil with the implant. And the speech processor was that box, which was a significant size and quite heavy. Then we moved on to what was called the Spectra, which people have been wearing up until quite recently, like as in last month, because they did last. That's one thing about them. And at this stage, you can see there's the magnet has been developed, and it was again body worn, but it was about half the size or a third of the size of the original one. And then moving down to the bottom, you can see the ear level speech processors that have changed over time. So we've got to the Nucleus 5, which, as it says, is 30% smaller. So, who can benefit? Firstly, someone with poor speech understanding in both ears. So this is probably the most important thing. So not necessarily the degree of deafness that's so important, but whether you can understand speech. And how we assess this is we test people with their hearing aids on. We test them on a number of different sentences, and we compare that to the scores of the average implant users. Okay, and we see if you score better than the average implant users, it's unlikely that you will improve with a CI, but if you score more poorly, then it's worth considering. Obviously, someone with a severe loss of hearing, as I've previously talked about, would be a candidate. Someone with an extensive hearing loss or a difficult hearing loss. And also someone who's unable to get the full benefit from their hearing aids because of practical problems would be a candidate. So someone with a severe loss of hearing who has difficulty managing their molds, or they get repeated infections, or they get lots of feedback that can't be improved. These people can benefit often from a cochlear implant. So it may not be, they may not fit other criteria, but it may end up just being that practically they're better with a cochlear implant. Someone with an extreme sloping hearing loss. These hearing losses are always difficult to fit with a hearing aid because this person with this audiogram has near normal hearing here in the lower frequencies and particularly poor hearing here in the higher frequencies. Without explaining the whole audiogram, you can see obviously that it's on a steep slope, and these sort of losses are difficult to fit with hearing aids. And some studies have been done recently which are comparing this sort of a loss to groups, one with hearing aids and one with implants, and the group with the implants did have an average better score. So coming to the most controversial and recent changing criteria, and that is the use of cochlear implants with single-sided deafness, or what we would call a profound loss of hearing in one ear. Until recently, these people would have either worn nothing, perhaps tried a bone-anchored hearing aid, or a Cross hearing aid. So there's a couple of options, without going into too much detail, which basically put a microphone on the deaf side and transfer the signal to the good side. So people are able to hear on their deaf side by using their good side. However, this does not give you back two ears. It just allows you to hear in that way. And what they've been doing recently, or starting to do, is put a cochlear implant in the deaf side and using it with a good ear. This has not been attempted until recently, probably because of the improvements in technology which have allowed better results. Previously, it was felt that the sound people would get through the implant would not be compatible with their natural hearing they got through the good side, and they would not be able to put the two signals together. I checked with Cochlear a couple of weeks ago to see what results had been... I checked a couple of weeks ago with Cochlear to see what results had been found, and that there didn't seem to be any results that had been published on this. So it's very early days as yet, but we at St Vincent's have got a couple of patients who've had an implant in their deaf side and found that it was a fairly positive thing. So it's an interesting time in cochlear implants. Thank you. One last thing I just wanted to say, sorry, before ending, and that is that because a cochlear implant involves surgery, it's not the same as getting a hearing aid. It's always going to be different. There is always that, that risk of surgery, and of course there's always the fact that we cannot predict how a given individual will go. So although we have to work on averages, but one individual we can't say you're definitely going to score very well with a cochlear implant. We can't actually do that, and so this always has to be considered before anyone thinks about an implant. Thank you for your time.